all of us who've been around this debate for a long time about, we've talked about prevention. We know it, we know we need to do it. We know we need to think about better evaluation and appraisal of our policy choices. But actually, it's dead easy to slip into one-year budgets and just kind of pushing money around. And your point about more money going into health, and we're seeing that. We're seeing, if you look at the relative share of the budget that's now in health, you look at the relative share of the budget that's now in social security, that's all being paid for by, essentially other areas picking up more heavy lifting, whether it be education, local government, economic development, all of those areas are doing it. I mean, I think you're right. I mean, there's almost a bit about, I think, going back to Christie, the language is always about this is coming, we need to get ready for it. Actually, what we see when we look at the numbers now is we're here. Like this is happening. Our population is now aged, and it's aging rapidly over the next 25 years. So this will hit the next parliament. Whoever makes up the government, it will hit the parliament after that. And they'll be the ones responsible for essentially having to make cuts in other areas in order to respond, to put more money into the fact that our population is aging. And I guess one of the things which I don't think we've done very well, and include people like ourselves in this as well, is that the presumption is that when we talk about making cuts or making changes, it's as though it's from the current status quo, and we say, oh, yes, we're having to take money from health in order to put into housing, or we're having to reprioritize money in one area to support that, as though that is what's going to continue over the next 5, 10, 15 years. But as our analysis shows, that is not what's going to happen. Essentially, in order to continue to pay for just the same standard of healthcare we have at the moment, you are actually going to have to make cuts elsewhere. So it's about reframing what is the status quo, and just this assumption that what we've got just now will always continue into the future. What our analysis says is, no, that's not right. If you don't do anything now, you're going to be making cuts repeatedly in the years to come. So the status quo is not the outcome you should be comparing yourself to. You should be thinking about what is coming down the line, and how you adjust to that.